It's my pleasure to welcome you to our first ever Conference in Public Health Forum on delivering value in public and preventive health. Today is both a celebration and a call to arms. We'll celebrate the Georgia Prevention Institute's rich and successful 30-year history of research in health promotion and disease prevention, and we'll also set in motion an ambitious agenda for the future to improve the health of our community.
Today, we are focusing on the health of our communities. Not the first time, but certainly on the most visible way. At the center of our discussion is value in public and preventive health. So certainly, public and preventive health are concepts that unite and inspire people to work together and achieve more together. So let's take a poll right now. If you want to work for public health, if you want to see the prevention of diseases, if you want to achieve healthier communities, then please raise your hand.
We have much work to do as we work to improve our community and the health of our citizens, but there has been a core group of very dedicated faculty and investigators who have been at this for years, and so we want to take this opportunity to recognize those, and that is the faculty and staff of the Georgia Prevention Institute, which just this past year celebrated its 30th anniversary. Congratulations to all of those who are associated with the Georgia Prevention Institute, and I'll count myself as one of you because, you know, nothing succeeds like success, as Dr. Buckley said, and all I can say is I'm really looking forward to your next 30 years. Thank you.
We can't be silent anymore. I think it was very important that we know the facts, engage the public, become much more vocal advocates for prevention and wellness. We need to show results. We do lots of things in which we don't measure the impact. And when they show the impact, we need to figure out how to take credit for it. We don't like to take credit for stuff, but we should, and we need to do more of that. And I think no one uses a political process. That means building relationships. You know, that means reaching across the aisle and with people that, you know, you just don't agree with. Now, part of our problem is that prevention is invisible because when it works, nothing happens. It's true. Okay? And we've got to figure out how we spin prevention to the point, you know, that we can put a sign in a restaurant and people continue to come to that restaurant and says, you know, 365 days and nobody got sick from our food. All right?
We have a lot of needs, a lot of opportunities. I think that we have a lot of resources in the area, and we just have to get together and see how we can mobilize the community.
We have a very active program of self-reliance. We call it Army Ready. Changed the name, and it's what the American Red Cross says every citizen should have.
Is relevant if we're asking the question also about what role do we play in this complex ecosystem, and how should we be thinking about it?
Our children are not getting the necessary exercise that they need to get, and not at home and not at school. So how do we remedy that?
Speaking of public education, we realize that we are responsible for about 90% of the youth education of the youth in this area.
I think it's a good time for this too, because with our, at least I know Oak Street Rights Clinic uses an electronic medical record system, and we use the same electronic medical record system. Easy to mine data, you know, and look at outcomes, and so I'm very optimistic.
So this Institute of Public and Preventive Health at Georgia Health Sciences University has a number of priorities. One of them is to improve health, reduce health disparities, and prevent injury and illness in Georgia through research, service, leadership, and training. It also it means to generate evidence and innovation to lead Georgia and the world to better and public and preventive health. We do want to produce the amount, the information, we do want to produce the services that are required to improve certainly the health of our community and the health of Georgia and consequently the health of the world. But nevertheless, it is important to recognize that on its first day of the Institute of Public and Preventive Health being born, we already are a large enterprise, and in fact, comparable to other public and preventive health institutes or colleges in Georgia, the Institute of Public Health at Georgia Health Sciences is second in Georgia in overall research and NIH funding, first among comparable institutes and schools at public universities in Georgia. And in fact, NIH funding is greater than the combined NIH funding of all comparable institutes and centers. We are third in the number of full-time research faculty. We do need to recruit. This is where investment is going to be required. We're first in the number of NIH dollars per full-time research faculty. This is actually not surprising. You should know that Georgia Health Sciences universities are among the most productive in the United States. For the size of the university, we are second overall nationally. The amount of NIH dollars that we bring in per full-time researcher at Georgia Health Sciences in all of our programs. So this is not surprising that, in fact, our public health researchers continue to be very productive. So with that, I really do want to thank you for coming today and, of course, helping us celebrate really the creation of the Institute of Public and Preventive Health.